Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. This is our show for the month of June, and we have a great guest with us, Heather King and Jeremy King. They both work with me at the University of Mississippi Medical Center. Heather is an infectious disease nurse practitioner, family nurse practitioner, by the way, and then Jeremy is the director of the training center at the University of Mississippi Medical Center, has been very instrumental in helping a lot of us physicians get our training in BLS, ALS, ACLS, and even ATLS. So we're going to continue our discussion with both of them. They both were raised in Pearl, Mississippi, went to college in Oxford, Old Miss, work currently in Jackson, still live in the Brandon area. And I just asked them a few minutes ago, I said, so you never really left Mississippi. So you are Mississippi bred. Everything we see around you is Mississippi bred. Wow. He told me the reason why they didn't leave was because that was where their family was. Mississippi is very family oriented, right? That's awesome. And I know you told me you go to another church from where you were born, where you grew up. What church do you go to right now?
We are attending Covenant Presbyterian.
Covenant Presbyterian, okay. I'm familiar with that. Somewhere in the Ridgewood, is that Ridgewood?
Yes.
That's right.
Drive, right, okay, good. So, is there anything you want to convey about faith on your journey? How has faith played a role in this journey of life that you've had? I mean, do you consider faith important? Do you think faith has inspired you to become who you are? Do you think God has a role in the successes that you've seen so far? I mean, just as for my audience, they want to know, hey, you two are an amazing couple, successful. What role did God play in all this?
I do believe faith does play a part.
Mm-hmm.
I believe we give praise to God.
Right.
I pray for guidance prior to all of my clinics,
Oh.
for guidance for my patients. And so I trust in God.
Mm-hmm.
And so that's how I believe faith plays a big
Oh.
part in
And
my
obviously,
career.
you try to raise your children in that same path because you were raised as Christians. So you try to raise them in that same nurture, in that same path. So that's awesome. Now, give me an example of, I mean, have you been in a fire where you were almost worried about your life? I mean, I don't know how many fires you've been in, but because, that's what everybody watching on TV thinks about when they think of a fireman. In fact, there are people who don't want to ever become a fireman because of what they've seen on the movies.
Yeah.
The houses falling in, and they're calling your name, and they drag you out, and that's
Sure.
what the movies, I don't watch a lot of them, but that's kind of the picture they paint of the fireman. So were you ever in that scenario, or you were more of the EMT medical side background?
No, I've been on both sides of
Okay.
that. So I've been in house fires where they're very hot, where you can't see, and all you can go by is basically on touch and feeling around because you can't see anything. And yeah, I was a little bit of an adrenaline junkie, especially when I was young. I'd welcome the chance to go run in and test myself with all these other folks. I mean, we would train for these emergencies, so we would know what to do when we were put in those situations. So I've never put myself, I think, knowingly in a terrible situation. I'm dealing with a fire that follows physics, and if you train for it and you learn about it, for the most part, you can make informed decisions about what you need to do. I remember looking down a crawl space in an attic and thinking, well, I can go that way, but it's too tight. I'm just going to punch a hole in the wall, and we're going to go around that right there. So trying to make these decisions when you're in a bad place. I've had several friends that great firemen, great people, very experienced, very knowledgeable, get put into bad situations when either training failed or something that was going on that they were not aware of, and they were making the best decisions that they could at the time without all the information, and they've had some pretty harrowing experiences. At the end of the day, these guys that are doing this, they do it for a love of each other, a love of the job, and a love of people. or else they wouldn't be there. The pay is not incredible, but I sure tell you what, the benefits that come from the people
From helping people.
working, these people that work with them and helping others is just incredible. You get another family is what you get. So a third of your life is spent with these guys at a station. That's a whole other family.
Heather, do you see that play out in your infectious disease clinic? Do your patients become like your family? Do you develop that camaraderie? I mean, that's oneness. Does that
Yes.
sound like something you guys experience?
Yes, definitely. I've been seeing some of my patients the entire time I've been in my position, so over 10 years. And yes, I know these people. I remember what's going on in their lives. I'm happy for them when things happen or are going right. I'm saddened when they're ill. I've had patients that have passed on from old age, and it makes me very sad.
And you've had people who passed away
Oh yeah,
in the course of fire duties, right?
right.
And that's very traumatizing too.
Well, I did have one of my first teachers in the paramedic world. He told me, he said, you try to learn everything you can, and it's constant, and try to prepare for those situations. So when the situation presents, even if you haven't been in it, you kind of know what to do or have an idea of what to do. And at the end of the day, if you've done the best that you can, and you've followed your training, and you did everything that you could, and you know that you did everything that you could, then you're probably not going to be able to sleep well that night, but you'll sleep better by telling yourself, I did everything that I could.
Wow. So tell us a bit about training the trainer, because you're a big proponent of training the trainer, trying to get more people trained in CPR, BLS, ACLS. So you've been doing that now at UMC for a few months. I've partaken of your training, and we really appreciate you for that. So just tell my audience what's your concept of why should we try to train as many people as possible in the basic resuscitation steps?
Okay, so for CPR, that's a big part of medical training for just about every person that wants to go into the medical field. They're going to need some version of CPR. As a paramedic and firefighter, I've been called to several scenes throughout my 20-year career, and I'll say that it's not a miracle kind of skills thing. A lot of times it doesn't work, but for the people that it does work. There's a man that married off his son a couple of weeks ago that was not going to make it had not somebody been there doing CPR and called us, and we were able to fix whatever the underlying cause was, and basically by defibrillating them with an AED, and his heart went back into a normal rhythm. He went to the hospital, he stayed there for a week, and he came out. He was cutting the grass a week later. And 4 or 5 years later, his son's finally been married. He's been able to see that. So there are several of those stories that I could point to in my career where somebody's getting almost a second chance of life, if you will. But I've never gone on a call where some bystander or somebody was not doing CPR, and I get there 15 minutes later, it's too late. All right? So as long as somebody had started the process to push the blood around, to push the oxygen around, to keep the brain and the heart alive as much as possible until we got there to fix that underlying cause, those people would have a chance.
Do you want to explain to my audience what CPR means and kind of demonstrate it if you can?
Sure, it's basically a cardiopulmonary resuscitation. And you may have seen this on TV several times, but what you'll see is there's a mannequin or a person there, and someone's standing over them, and they have their hands put on their chest, and when they're compressing with their arms, they're basically pressing the heart in between the spine and the sternum and causing the heart to compress. So when the heart compresses, the blood flows out of the heart into the body. Again, the blood is what carries your oxygen. So the oxygen goes to the heart, to the brain, to kind of keep them alive, to keep them oxygenated until we can figure out what's wrong and what's caused this heart attack, or what's caused this heart to go into one of these abnormal rhythms. And sometimes we can correct that deficiency in the body, and then that person's heart will begin to beat on their own. We'll send them to the hospital. They'll go into the ICU for a little while, and God willing, they'll come out and walk out on their own 2 feet and see their son married 3 or 4 years later.
Well, somebody's watching and they're like, but I don't have the equipment. I don't have, the AEDs. I don't have the valvula, the breathing mask to breathe into their mouth. What do you say to those people? They're like, I don't want to just breathe into a stranger's mouth. I want to have the equipment. What do you say to those people who make that as an excuse?
So
they don't have the proper equipment or gadgets.
Right. Well, there are certain gadgets and certain equipment that are coming out to teach you the correct rate and correct depth on which to push that. Which even it's new technology, but you could put your phone on the bed with an app, and it will kind of give you some kind of idea about how you're doing, even if you're trying to work on a pillow, if you will. I would say that there are a lot of organizations out there that are willing to teach, that are willing to have you in there for little to no cost in order to get this message out. I spoke with a first-year med student who's been an instructor, a BLS instructor, for several years, and she said, hey, I want to start an organization where we can, this is yesterday I was talking with her. She said, I want to start a little organization with some of my other med students. Would you be willing to teach us how to teach the courses? And we'll go out to churches and perform civic duties or clinics or this, that, or the other all over the state, and we'll deliver that training. I said, that'd be fantastic. And I said, and if you find some folks that are really, really interested in this, we'll allow you to make other instructors out in the rural areas, and then that will just compound the knowledge of that. If I'm an instructor, I only have so many hours, but if I teach you how to do it, well, now there's 2 of us.
Right.
Now we can get more people involved, and if we teach more people how to teach, then it just compounds.
Some of my viewers are worried about COVID. I mean, give us an idea. How do you resuscitate in the midst of COVID?
So this is what I'll say about, you see CPR, and there's a lot of times these mouth-to-mouth going on, or the resuscitations. So in the early years, in the early 2000s, a lot of people, CPR was becoming popular, people were doing it, and then what we saw there were some folks that were just hesitant to do that, right, to do the whole thing. So what we started teaching was chest compressions only will work for so long. There's still a residual amount of oxygen in the blood that can be pushed around the body to keep the heart and the brain alive until the fire department comes and they bring their equipment to where they can resuscitate, and they don't have to put your mouths on people. So even if you can do chest compressions only until somebody comes and takes over for you, that's better than nothing at all. And that could be the factor that saves your loved one. Right? So just do chest compressions only. If you can get the idea and a little bit of training with that, the rest of it is kind of the icing on the cake, but that's what's going to do it right there.
So, Heather, you're in a very unique environment. Mississippi has, I believe, 60 to 70% African American HIV prevalence. So what people see in the HIV clinic when they come is, and I hate to put it this way, but it's a Caucasian nurse ministering or helping or talking and ministering to mostly African American patients. Has that ever been a difficulty for you? Have you ever been maybe, I hate to use the word, given any racial undertones or made to think you were treated differently because you were of a different race? Has that ever, because some people think it's a racial profiling, they want, all this, discussion about race. So I tell my patients all the time, if you have a brain bleed, please don't ask for a black neurosurgeon. Get a neurosurgeon, okay? So I hope that has never been something you've experienced in your time with HIV or hepatitis.
No, it has not been a problem.
Okay.
We're all people.
Right.
We're all human. I just want to help my patients, and I think my patients see that.
Right.
I don't ever look at color, and I haven't gotten any of that from my patients either. They know I'm there to help them.
How about sex? Males are different from females. Do you think your male patients are uncomfortable with the female talking about STDs? Is that something you've experienced, or do you think your female patients are more comfortable talking with a female patient? What do you think is the dynamic there?
That's a really good question. I think everyone is uncomfortable talking about sex to begin with. I don't think it matters if you're male or female. I think to begin with, everyone is. When you become comfortable, when you have a comfortable patient-provider relationship, your patients then trust you and they'll open up. Some patients are more comfortable talking to someone of the same sex, maybe due to past experiences. But overall, if you provide each other with mutual respect and they're comfortable with you, they will open up to you.
So how do we end the epidemic? I think the goal from the federal government is 2020? Or was it 2030? It was 2030.
Yeah, I think now it's 2030.
Okay. It was 2020, right?
Yeah, they keep moving it.
They keep moving it.
Yeah. So, I mean, the goal, we need to test our patients for HIV and hepatitis. We need to get those patients into care. We need to help to keep those patients into care, encourage them to take their medications and to take care of their other health problems, such as hypertension, diabetes.
Right.
HIV is a treatable disease, like we discussed earlier. Hepatitis C is a curable disease.
It's a curable disease, right.
And my patients live long, healthy, fruitful lives. You live with HIV. It's not the disease that it once was in the 1980s.
You can go to work, you can
Yes.
raise a family.
Yes, you can have a family.
You can have children.
Yes.
Those are all, you've had patients who had all that.
Yes.
They had children and all that.
Yes. All of it.
Yeah, I actually had a patient who, I mean, she and her husband are still together, even though she thinks, he gave it to her. And so, I mean, she's doing great. So, again, that brings up the issue of forgiveness and love. And I'm amazed because I know very few couples will remain together. Have you noticed that in your practice, that some couples, it affects the marriage when one is found to be the source of the HIV? But some stay together. So this lady I was really, really impressed by.
Yes.
You know.
Yes, some do stay together and are very, they're very encouraging. They come to appointments with their partner.
Right.
They help encourage them to take their medications. They understand how it's transmitted. They understand that their partner needs to take the medication to become undetectable so it's no longer transmittable.
Right.
But yes, we do have patients that stay together when one person is positive and one who's not. Yes.
Right. And of course, like you said earlier, if one person is positive and one is not, then the one who's not better take the PrEP.
Not necessarily.
Oh, really?
It depends. If that patient is undetectable,
Okay.
undetectable is untransmittable.
They don't have to take the PrEP.
But if the other partner would feel more comfortable taking PrEP, then yes, by all means, then we encourage PrEP.
Oh, wow.
We encourage PrEP for all who desire it.
So you basically see adults at the moment. So, so you don't see the pediatric patients.
No, my clinic is adult only.
It's only adults, okay. Because I've heard that we had Mississippi, and the last statistic I read, Louisiana and Mississippi were in the top 10 at least for HIV, syphilis, gonorrhea, chlamydia. I think you can correct me if I'm wrong, but I think Mississippi was #1 for gonorrhea and #3 for chlamydia.
We usually stay in the top of all of those.
Okay.
We may go down one step and then we come back up again.
But this is the Bible Belt. So again, correct me if I'm wrong, but you would think the Bible Belt, those things are not as. So why does a Bible Belt state like Mississippi have the highest rate of gonorrhea, and the second highest rate of chlamydia, and the third highest rate of syphilis?
That's a very good question. I feel that it's because sex is more of a taboo subject.
Okay.
People don't really talk about it. So it's important that, if you're considering, becoming sexually active with a partner, talk about it, talk about protection. You're protecting yourself and you're protecting your loved one. But I feel that that's the reason why, is because
we
it's
don't
just more of
talk
a,
about
we
it.
don't talk about it.
Wow. Wow. So we've got to do a better work discussing it in high school, maybe, and you know, scenarios before they get active.
We need
So
to
they
normalize, healthy relationships,
Okay.
open relationships where you talk.
Sex
And
education is taught in schools, though, right? But it's limited.
it
in your
is,
view
it
of
is
that.
limited, yes. I feel like you need to talk about it at home, because you don't
Okay.
know exactly what is being taught at the
At
school.
the school.
So parents just need to teach their children about relationships and about protection for when they do become sexually active.
Those are uncomfortable
are
conversations
Have
for
you had
parents,
yours?
aren't they?
Have you had
Yes,
yours?
we
We
have.
have.
Okay.
And it's one of those things you kind of don't want to do as a parent almost, and it
But you
may be
have
our
to.
culture, I suppose, just that it is a little bit taboo. But at the end of the day, I'm trying to look out for them and let them know the potential consequences of sexual activity. So yes, we've had those conversations, and yes, they were pretty frank and pretty blunt, and it just is what it is. I think that comes from
So my dad
yeah.
came from the very, very, very old school. And I'm saying this because he passed 2 years ago, but my dad would say to all of us, he says, if you get HIV, I will disown you.
Oh, wow.
This was like I said, he was very, 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 he was a military guy. Obviously, I don't think he would have
Right.
done that, but he was just being threatening and using that as a...
Unfortunately, I've heard that.
You've heard that too?
Yes, it is still, that's still prevalent in some of our communities. There is such a stigma attached to it, unfortunately. And so patients are afraid of telling their loved ones their status. And so they try to hide it, and they don't feel that they have the support. And, you need that support.
Right.
With any illness, whether it's diabetes or HIV, you need the support of your loved ones. And unfortunately, they don't feel like they have that.
I know there's a lot of patients with HIV in the past. When I started practicing in New York, in fact, you couldn't break the news to a patient without some psychological background. You couldn't tell them over the phone. You couldn't tell them in person without them having, like, if they needed psychological support, they would get it. So do you still see that a lot? Do they need psychological support in the HIV world? Do they need motivation? I don't know. You guys have that in your facility?
We do. We do
Okay.
have a mental health coordinator.
Social worker?
Right, we have social workers, we have nurse case managers. We help to provide any support that our patients need, whether it's mental health, whether it's social support, housing, food. We try to provide any support that they need.
Okay. Wow. So you two are like a picture of success to my viewers. Young couple, 2 children, living the dream. What would you tell my viewers, especially the young college and high school students who want to follow in your footsteps? What advice would you give them for those who want to follow in your footsteps? They want to marry the woman of their dreams, the man of their dreams. They want to have a family. They want to have raised children who are disciplined and fear the Lord. They want to be connected to their extended family. And they want to have a sustainable source of income that can help them to do what they love to do, like go and play music and enjoy their time with their family, So what would be your advice to my 12th grade high school student who looks at you and wants to be an EMT or a nurse, a practitioner? How did you get there? What advice would you give them?
Just in general, to anyone, I would say that it's okay if you don't know what you want to be. It's going to manifest itself in some way or the other. Try to get out there, try to figure out what you're interested in, and just make opportunities for yourself. Don't wait on somebody to bring something to you. Get out there and try to learn a little bit. Go get a job. See if you like that job. If you don't like that job, you've at least learned that you don't want to do that, right? So just keep trying. keep exploring new opportunities, and something you're going to find something that you like to do, that you want to do. It will manifest itself, and then continue along that pathway. Try to make those opportunities happen for yourself. Nobody, typically, I've never found anybody just to throw something in my lap and say, here you go, run with this. It's more or less, I was trying to accomplish some goal, and it opened up more doors.
So the first step is take a step, right?
Take a step. Get out there and do something, right?
Start doing something with what God has given you, with the gift you have.
That's right.
Right.
In the relationship aspect, I'd say marry your best friend, the person
Agreed.
that you like sticking around with every day, that you enjoy doing things with. Give it some time. Foster that relationship. See where it goes. If you're happy with each other, then it's good to go there.
Yeah,
Right.
everything will fall into place. And you know, some people say, well, I'm thinking that I want to go to medical school, or I want to go to nursing school, or I want to become a lawyer, but it's going to take forever. Well, the days are long, but the years are short. You will eventually get there, so why not do something that you're going to love
Right.
and stick with it?
So if you choose a career, choose one that you love.
Right.
Okay.
Not just because it's going to be the fastest thing. Choose something that you really are
You really
passionate
love
about,
and passionate
and
about.
surround yourself with others who are smarter than you and can help guide you.
Awesome. Wow. We've been talking to Jeremy and Heather King, two of my favorite people, Mississippi bred, Mississippi born, and Mississippi boom. They've become successful in the state of Mississippi using their God-given talents, EMT and a nurse practitioner. And they've touched several lives. That's our prayer, that you too will hear this and go out and touch several lives. Hear me, Jesus loves you. You don't want to go without knowing him. Jesus is Lord. God bless you. Awesome.